All right, everybody, welcome. I will call to order this meeting of the Dunn County Health and Human Services Board for Thursday, August 22nd. Let the record show that Supervisor Breslin is excused and Dr. Hall is excused. Gavin went to college today. Supervisor Bashan, Supervisor Hagan, Supervisor Steen and I are here. Miss Rudy is also present. We have a quorum. Let's approve the meeting minutes from July 25th.
I so move, Madam Chairman.
Thank you for that motion. Is there a second? Second. Ms. Rudy seconds. Any additions or corrections to the minutes? Additions or corrections? If not, all in favor? Aye. Any opposed? Minutes from July 25th are approved. Do we have any public comment? Nothing?
We do not.
Okay, all right. Moving ahead. Next meeting, hard for me to believe that it's the end of September, but it's the end of summer. So September 26th, okay, still on everybody's calendars, all right? All right, item 6, there is nothing. I did not place any items on the agenda.
Thank you.
You're all very welcome. Veteran Services is next, Greg.
All right, good evening, everyone. I'll be briefing by exception as far as handout documents. However, I will pull up on the screen for purposes of when we get to the financial pages as well. So.
Totally fine, not a problem.
Bear with me, I'm just getting to the right page here. So the first thing I'll go through, and it's not included in here, is just to kind of go through an update over the last month for the Veterans Service Office. I'll pull up on the screen our client served report just to kind of give a little bit of a snapshot. As long as I find out where to share. Am I able to share? Okay. I'm sure they are. So we'd seen a bit of an uptick in looking at the client served report over the month of July, at least as it shows for the
We've exchanged some messages. But yeah.
But maybe it's his friend. I don't know. If it's his friend, I can understand.
That's definitely.
I think I'm joining the meeting twice. All right, so I'm gonna.
We see you up there.
Yeah. I just have to open the document up on the correct page to be able to view it. So we had a little bit of an uptick for the client served report, and I would go ahead and identify that as just in that month of July, weather's changing. Individuals again are kind of looking at closing things up as we kind of head towards August. And I think historically, when you look back, that is an area that around that month that we see an uptick. The other thing is once I get this pulled up here. You'll be able to see that over the month we had a few more compensation claims that were submitted in comparison to looking back through June, which we were at 92. So I'm gonna hunt for right now until I can get that.
That's okay,
get my
Greg.
files opened up here. So with that report for the month, when we're looking at the actual retroactive payments, you'll see that the retroactive payments are at about $94,608, giving us a total for the year of about $766,000 that has come in real money. So I think that's a significant amount, and kind of looking at it and comparing to last year, I would anticipate that will be roughly around the same amount. And that's what's positive about that is that that means that the VA is processing claims. We can certainly put in 1,000 claims, but if they continue at the same processing speed, I think we can anticipate quite a bit of that retroactive money. And as time goes on, I'm anticipating that hopefully that'll be around the baseline for the new work that we do to help bring in the money for individuals. So medical equipment kind of stayed about the same. So I'll end with that part, and kind of in brief by exception on the 2024 budget to give a
Sure.
financial update on that, and then I'll get my screen corrected when we get to the action items here. I gotta open the folder up. Yeah. So with the 2024 budget up to this point, things are on track at this point. I don't see anything significant that should cause any problems as the budget moves forward. We had quite a bit of funds that we did a transfer forward that were donation monies for medical equipment and relief funds. So with that amount, I anticipate, unless we start to see a huge influx of need through the requests for homeless prevention or the utility disconnect, then we might start to rapidly use a bit of those funds. And we've had, I think, last report in July, I think we had roughly two to three homeless individuals at the time, and we still have continuous contact. One individual is working. He's trying to be successful through treatment, and we're going to be there at the end if he satisfies that, to help him get a permanent roof over his head. So hopefully that'll be resolved, and then we assisted with first month's rent to help individual that their house was condemned, and that was a surviving spouse.
Thank you for bringing that up, because I was going to ask you about that when I reviewed the minutes, the uptick in veterans homelessness.
Yeah, I think again, pattern wise, I would kind of look to some of my counterparts here, if this is that time. Historically, I've been kind of doing this work for a long time, and this is that time of the year that more individuals start, in my opinion, to engage in trying to get services to get permanent housing. And I think that has a lot to do with kind of that stabilizing, for their kids going into getting ready for school, as well as the ease of finding a spot to temporarily hang your hat. It's easier over the summer, and then now, weather starts to change, and so I think that starts to get on people's minds. So that's why I'd see that uptick. And I'm not. I anticipate we've got a few people. We haven't had any contact with them in the month of August. A couple others that I know that are still out there, but they've got some criminal stuff that has to be resolved here. So they may have permanent housing in a different manner, and then we'll just have to work on resources and services for them upon them entering back. So yeah, so we're thankfully we have resources, and way we approach it is we're the payer of last resort. So we use our other resources that exist through Center for Veterans Issues, which is a grant-funded program from the state, as well as the Wisconsin Department of Veterans Affairs, and then we'll be that third layer, because sometimes they're unable to assist. So that's about it that I have really, that I think is significant in relation to our 2024 budget, that we do have funds that are readily accessible to assist if there is a need along the other budgetary operations, as well as our grant funds. Things are all on track. I have one adjustment that has to be made that I'll work with Beata and her team to make an adjustment for our grant that was supposed to be charged into operations, but it's minimal. Any questions regarding the client served report that I discussed, as well as the 2024 budget?
Any questions for Greg? If not, Supervisor Hagan.
Thank you. I just want to highlight, I had the honor, I suppose, to talk with a person who informed me that they were a veteran, currently homeless as well, and they were getting assistance through your office. So I just wanted to highlight your work with that issue, and thank you guys, because they definitely appreciate all the help that you've been giving them.
Good. I'm glad to hear that, and I'm glad they were willing to share that with you as well. I think that's a good testament of trust.
Yeah, and thanks for sharing the compliment, Supervisor Hagan. All right, any other questions? If not, we're on to public health.
So you guys have in your packet a quick update. As always, I'd like to pull out just a couple things which I think are fantastic. So we received funding from the Community Foundation, specifically the Byron and Catherine Olson Memorial Fund, to purchase a vein finder for our clinic. And so you see that fantastic little picture up there. I'm going to make it bigger because I'm just so excited by science. And so what that does, when somebody is very dehydrated, or maybe have collapsed veins, that it can be really difficult for us to find a vein. And so when we're doing specifically STI testing in people, especially people who may be using drugs, then if we can't pull the sample, then they have to come back. And oftentimes those folks are not as permanent as we would like to see. And so that is a barrier that we want to remove. And so this gives us the ability to be more successful with those blood draws. Our current policy is that we'll attempt twice. One nurse will attempt, and then another nurse will attempt. And so this gives us a better ability to be successful, and again, get people the answers they need so that they can make good choices about keeping themselves and the people they love safe. So I wanted to point that out, and it is awesome. All right. Oops, too big.
Thank you for making it bigger, because it was hard to see on the in the printed version.
And then another thing that I wanted to share is that we are starting to really coordinate Narcan saturation within the community. And so we were able to put together a fantastic multidisciplinary team and have an action plan put together that we're going to check back in on. And so again, partnership and the different partners are spelled out here as well. But really excited about that harm reduction practice gaining a little bit of legs in the community. And then lastly, something that I am really excited about, mostly excited that it's over, is that we had our 140 review. We do that every 5 years. And so we are awaiting that report. I have no expectation that it will change from a level 3 health department, even though the metrics have changed. And so for me, I'm a little type A sometimes. And so knowing exactly what to check off my list makes me feel better. And this was a conversation. Oh my gosh. But it was a very nice conversation. I don't anticipate any challenges, but we look forward to that opportunity. Again, happy it's over.
Yeah.
Any questions from the update that I provided or anything in your packet?
Yes, can you talk a little bit about parvovirus? Which, I mean, I had heard a report on National Public Radio about it, and parvovirus is a canine
Sure. So
disease.
as you know, that there are families of diseases, and some of those diseases impact people. Some of those specific species impact animals. And so a good example would be kennel cough and whooping cough. They come from the same family of diseases, but they're different. So this parvovirus is actually what is called Fifth's disease, or it has a slapped cheek
Yeah.
rash. And so it's a very common childhood disease. We connect with childcare operations often when they're thinking about an outbreak or have concerns about an outbreak. The challenge is that it's so prevalent right now, and there is some concern that in certain populations, pregnant people, people that have impacts to their ability to carry hemoglobin in their blood, so sickle cell trait, that it can be really challenging. And so with this high degree of prevalence in the community, there needs to be a high degree of suspicion. And we want our providers to understand that this could deeply adversely impact those specific groups.
Interesting. Thank you.
Yeah.
Update. Any other questions for KT? Moving on. You want to do finances?
Of course I do.
Of course you do.
Thank you for that reminder. I'll just go ahead and share again from the packet. All right, so this is our year to date, and there are some traits that some issues within this budget that we are tracking down right now. So the biggest one is that we do continue to look like we're going to be underspent for our public health ARPA dollars, which sunset at the end of this year. So we have a spend down plan. We've re-engaged not only with hiring a nurse to provide some transition, for a public health nurse that is very rightfully so, but going to be retiring after long-term employment, and spending down just the buckets of leave that they've been able to accrue in the 30 plus years they've spent with the county.
Yeah.
But we've also connected back to Birth to Three to see where else we can support them, as that is an approved use of those funds. We asked for the ability to purchase more harm reduction strategy, which is an approved in the scope of work use of those funds. And we're just being really mindful. So one of the things that I'm looking at is that lag in gears, so the DHS contract reporting cycle, there is a lag. So we're about 2 months behind, but I'm still a little concerned. And so we are making movement so that we don't inappropriately spend that money, but then also don't leave anything inappropriately on the
Behind.
table.
Yeah, let's not do that.
Yep. And then there are a couple things, as you guys have heard me talk about before, tracking down people's time and having them go into the appropriate cost center. And so we have a grant cost center for public health ARPA, and that new nurse that we had just hired is still hitting the public health admin cost center. And so to get that moved appropriately over will show a difference in not only the levy that we'll put back, but more successfully use that public health ARPA dollars. We do have also the ARPA, I'm sorry, that's not right. The COVID immunization supplement funding, and that goes until June of next year. So we're also watching that funding as well. So that's about $300,000. Not all budgeted for this year. We have some budgeted for next year as well. So those are the things that I'm watching very closely, so that you guys know, because of ERP, some of my time, some of our nurse manager's time is not in levy the way it would have been as it budgeted. So we do anticipate that funding will go back to levy. But really what I'm watching very closely is not losing out on ARPA dollars that can be used here in Dunn County.
Absolutely. Any questions for KT on either the update or almost the end of the year finances. All right.
I
Thank
kind of
you.
have a question.
Supervisor Hagan, of
clarification maybe,
course.
Sorry. For in your report, the environmental health inspection frequencies, you indicated that there's going to be less inspections coming up, which it sounds great and everything like that. I was just wondering, budgetarily wise, is that reduction then accounted for the 2025 budget proposal?
So what that is functionally going to do is, because we time track and we know how much time we're spending in each kind of facility, it will likely impact the licenses for the places that we can not inspect as frequently. So the low risk ones like tourist rooming houses and vending machines, that kind of thing, but appropriately put time back into our restaurants and food establishments. And so we'll probably end up seeing, based on time, that there will be an increase after we have, next time you approve fees, that there will be an increase in those food fees and a decrease in those ones where we're not spending as much time. So it should be net neutral.
Okay.
But the time will be appropriately spent where we can really affect a culture of food safety.
Sure, absolutely. Okay, thank you.
And we will be looking at that again as the time, as we get more data about the time tracking, excuse me.
Sure. Yeah. Okay. All right. Thank you.
Any other questions? All right, public health. I'm sorry, I did say that. Thank you. Don't listen to what I say.
Do what you're supposed to.
Do what you're supposed to.
Sure.
Apparently I can't handle it.
Sitting next to
Does.
that's dumb's gonna say.
What's he gonna do?
All right. I have up on the screen the Human Services Director report for this month. In there, I included a packet or a document called the Impact of ADRC and Tribal Programs in Wisconsin Status Report for 2023. And I thought that had a lot of interesting data in it for you. And so certainly if you have anything, questions beyond what I can answer, Tracy is always available to help with that. I did think it was a great statistic of 101 emergency department visits per 1,000 people served. That's a lot.
And the
Lot.
$3 and it's either 38 cents or $3.88 ROI. That was nice data.
That's good. HAT, we did come up with a consistent name between the two work groups, and it stayed HAT because number one, it's a catchy name. Number two, all the logos are already printed for that, and we'd have to spend a lot of money to change things, and why do that, right? So it made sense to continue with that. And then the discharge data for RWC was also included in the packet, and I found this very interesting because in CCS, we really are a recovery program. And so we should be working with the end in mind, like what does recovery look like? What kind of goals do we have? And it's not a lifelong program. It is a program to help you work towards recovery. And so when it first started, cases went on forever and did not have a discharge basically because people were enjoying the services and those things, but is really now turned the page of what does the look like and how do we do that. So that was some really great work that's going on by Dunn County and the RWC team. It was great to hear that we were kind of on the forefront of that with that in our program. The other thing I wanted to share with you is the RWC. So when I talk about RWC, so Recovery and Wellness Consortium and CCS, we actually have two different arms of this program within our department. And so one arm is that we offer service facilitation, clinical or clinical review of cases, management of CCS cases, and that's one arm. And the other arm is that our mental health clinic and first episode psychosis choices program are providers for RWC. So that means that we are on the provider contract list for the service facilitators, that if there's a consumer that is wanting our clinic services or first episode psychosis program, that they can contract and use our services through our clinic. And so then our clinic or FEP then provides the service, and then we bill through RWC and we get reimbursed for that. And when I looked at the dollars that come in for that last year, it was about 700,000 that came in as a provider of just CCS services. And I think that would just continue to get bigger as we get kind of better at that. When we started this, and obviously I wasn't here, but some of the conversations I've had with managers and staff is that you start small and you kind of are looking at things, and it kind of just was all swooped together underneath one CCS kind of thing. And so the managers who were doing the service facilitation and some of that, and the clinic person, they'd talk once in a while or do whatever, but there really wasn't an emphasis on this is a provider contract program. And with the changes that have been made in the last several months with all that's going on with RWC and some of the contracted providers, they have really gone much deeper into what expectations are of providers, and had actually done a assessment of providers, and then came out with a notice this week as to which providers that the consortium works with that would be contracting next year, which ones would not be contracting, and which ones that would be contracting but kind of put on a plan that needed some things changed to be able to do that. And so there was 4 counties that were included in that, and Dunn County was one of those. And I can understand the reasons why. It's some things that we've already started working on a little while ago, but it takes some time to change systems and get everything in place. And we are being evaluated from back before we made changes as well. So one of the things we did is hire a program assistant in that program to make sure that all of the required certification and documentations are in what the RWC says is SharePoint, and to make sure that we're in compliance with all of that. And so now we are in compliance with all of that. One of the other things is really looking at this as a provider or a contracted service. And so we joined a team together of a few staff and finance and managers that are really going to be looking at this as a different arm versus kind of all together, and that this is an important contract that we hold as the clinic and FEP, and working to put things in place that that were outlined as far as what we needed to do to improve with that. So I wanted, number one, to make you aware that we were kind of put on notice that we needed to make those changes, and that we are making those changes and working hard at that, and kind of the reasons for that, and that the department is really looking at kind of that change process of how we're handling the contract end of it as a provider. And so we have that. We are also meeting with RWC next week to review what we're doing in our plans and to notify them kind of what our plan of correction, if you want to say, is.
Yeah, thanks for getting on top of that.
Yeah. So I don't foresee future issues, but with that, because I think that our plan, is solid, but I want you to be aware of that. So we have that. I also wanted to let you know, this happened after I sent out my document for you, is that We completed a um, strategic planning process, the beginning of that with our leadership team. We developed a vision, mission, and values, and then we completed at one session and then another one. We had a facilitated SWOT, strengths, weaknesses, opportunities, threats, facilitated process where we identified some action items. And so what came to the top for us as a leadership team was rising community needs. So the complexity of needs. So, we were really seeing acuity of mental health, substance abuse, just really that community need is so different than it was even prior to COVID. It just really, really is. And secondly, the second top one was housing. And it, with our workers, it consumes so much of their time, even though it's not really their job. It's not in their job duties or responsibilities. But as you know, when you're looking at, working with individuals, if you don't have a safe house to live in, you're not going to concentrate on your addiction or any of those other things that, getting the kids to school, any of those other kinds of things because you're sleeping in your car, right? Or the food and all of those kinds of things. So when we look at that housing piece and really the realization that like there's several different community and county different things that are really concerned and working on these things and do a piece of it. There's really not anyone that does that case management piece of coordinating and helping people fill out housing, applications and all the kinds of things that are really complicated, or to help reduce the barriers. And so agencies like the Veterans Department and our department and others are trying to do the best we can, but there just really is not that capacity or role of anybody. And so that's a significant need. And so we did put that as, one of our top areas of needing to continue to look at with that. The other one was standardized accountability across our human services systems. And so what does performance measure look like? Are we handling one staff in one unit the same as the other? The kind of that consistency of performance or outcomes of our product or services. And then silos. So there's great work being done in each of our units, but we can get better at not passing people from this unit to this unit to this unit was another area. And then the need to retain quality staff was the next. So, I mean, there's a ton of them listed, but those were our top priorities. And then from there, as any strategic plan, we will start strategizing what we do about some of these things. And I will bring the plan back to you
That would be
so
great.
that you can see that work that we're doing, but kind of focusing on what there's so much to do. Where do we want to focus our energy and time? And so these were some of those areas. So I wanted to share that with you. And then lastly, the opioid settlement funds. We have had a work group that I've been assigned to kind of facilitate, but like KT's part of it, the sheriff's part of it, Menominee PD. What am I missing?
CJCC.
Thank you. I knew there was somebody else on important role there. So we've come together to talk about what, what those funds could be used with. And we have been given direction by the county board chair and Chris to develop this list. And if there's things that we want to request action on in the near future, that a resolution should come back to this committee.
Okay.
And that, then you would review it. So I just wanted to kind of give you that update as well, that we do have some items that we would like to move forward on. And so, most likely next meeting, if not the following meeting, we'll have a resolution developed to start here at this committee to really look at those funds. Right now, there's over $400,000, I think, in that fund. But the way it works is there's continuing money coming in from the different types of
Right.
settlements and interest and all those kinds of things. So just really looking at what do we want to prioritize we don't want to spend it all. We want to, to be really good stewards of that money, but we'll bring that back for you to look at. But I wanted to give you that
Interesting.
awareness as well, that's, kind of out there. So I think that's all that, I hope you enjoyed the fun things that
Yes.
staff are proud of, because
Yes.
I just thought that was really cool to be able to share with you some fun things. Those meetings were just my bucket fillers. They're just wonderful, amazing staff that we have here. So that's that piece. And then I wanted to share the fiscal report. Let's see if I can get that up. That bigger? Okay. So that was in your packet,
Mhm.
and at the end of July, we were sitting with 490,596 to the good in our program areas. And so we continue to watch this, but I think we're sitting okay at this time. Hopefully that will continue. Any questions on that report?
Any questions on the financial report or the program update? No? All right. Well done on budgets, everybody. Yeah, Supervisor Steen.
I don't know. Madam Chair, I'd like to make a comment on the ADRC if I might.
Certainly.
As being a member of a certain age group, I am currently engaging with the ADRC. Their help, empathy and their help is really needed. Supposedly, I'm a halfway intelligent guy, but I have a heck of a time navigating the IRIS program and some other programs. And our staff have been very, very helpful to us. And I deal with some of this stuff, so I can't imagine if you take an elderly person that is not well versed at all, how confusing this is. And I know that, IRIS and these other programs, they have their own way of doing things, but sometimes it's hard for the layman to understand that. So I just want to extend a thank you to the ADRC staff, excellent people. And then I don't know if this is the right spot or not, but I forwarded Dr. Hall's report to Kyle Christensen, who is our top lobbyist at the WCA, and also Dale Knapp, who's the head of Forward Analytics. And I guess to start the groundwork with Dr. Hall's report. And Mr. Christensen indicated to me that after a brief looking at it, that he thought the DPI, his cohorts over there, would be very interested in the information that was put forth in there. And then I went and talked to the chairman, the head of the WCA, and said, I don't know if any other counties have done it this way, or if it's broken down, but I said, when it's appropriate, I think that if every county would do this and present it as a unified front, because it's really kind of eye-opening when it's put down on that granular type of presentation. So I just wanted to tell you that I did do that. So, and I'll if any movement happens, I'll report back. But thank you.
And it was, I don't know if anybody noticed, but it was picked up by the Colfax Messenger.
And
Yeah, Leanne obviously found it as interesting as we did. She obviously looked at our last meeting. So I saved the article actually for Dr. Hall. Maybe we should rethink sending that to the whole board. We did offer a comment that it was lengthy and detailed, but maybe we should rethink. Thank you, Supervisor Steen. Thank you. All right, anything else for public health or DHS? All right, moving on. Item 10A, we've got July DHS vouchers. Bottom line being 172,816.05. I need a motion to note review.
I would so move, Madam Chairman.
Supervisor Steen moves. Is there a second? Supervisor Bashan seconds. Any questions, comments? If not, all in favor of noting review of the July vouchers, say aye.
Aye.
Aye. Any opposed? Noted. We've got budgets. The DHS budget was, which we also looked at last month, was in your packet. Otherwise, I just asked that we put it up on the screen, and do understand that these are not finalized budgets, that there's a lot of stuff, a lot of attention, and a lot of work that goes on, but we are obligated as a committee to approve these as they move forward. So I don't know who wants to start. Okay. Human Services is up.
This is the summary of the 2025 proposed budget, and it is exactly what you looked at last month. There has been no changes to
Okay.
it. So at this point, it was over by 822,202. But again, there are some areas like the mental health pieces that were not completely done. But we are waiting on an updated salary and fringe
Right.
review of it, because until we get that, because what they do is give us the one that was at that time when we started it, and then they'll give us a second one. And those salary and fringes really drive everything
Of course.
else, because kind of they're the stable factor, and then you kind of build in the other pieces. And our budget is so tied together that if you change one salary and fringe, it changes
course.
the whole budget. So we don't want to start looking at this and making some of those changes to the mental health area that Jerry talked about last time until we have that updated PEP. And so we will be doing that, but at this point, it's still 822,202. So that's the same as last
Any
month.
questions on this, Supervisor Hagan?
Thank you. I kind of have a question, I guess. Were there talks earlier this year about potential needing for placements for next year?
Placements are always an issue, and one of the things with that is you don't know. And so I know that we've had a couple cases that the placements would have what we consider closed due to the case closing for termination of parental rights. Once the court orders that, then we no longer pay for that, the state does. So there's a couple of those, but there is also one that is a very, very high risk for community placement, or community needing to be removed from the community, and we're just every day kind of monitoring that one. And if that placement happens, it would be very expensive. So again, like, it's hard to predict what next year will look like. So what we do is take an average of years, in the past for placement, but we do have, I know at least one significant one that's kind of on the fence.
Okay,
Yeah.
thank you.
If that answers your question.
Yeah, it does. Thanks.
All right, any further questions? If not, I need a motion to approve the DHS budget as prepared as of this date.
My motion.
Supervisor Hagan, is there a second? Supervisor Bashand, any further discussion? If not, all in favor signify by saying aye.
Aye.
Aye. Any opposed? Okay, approved. Public health is next.
Okay, so much like Paula shared, this is the same budget that you saw last month. And so this is the roll-up detail. A same situation, we do have additional dollars that we will need to accommodate, and we will need to change our personnel salary and fringe. So what you're looking at right now is actually a balanced budget. And the 192 was the expense specifically for ERP. And so that is the personnel time that would go into ERP, and that was for the countywide project. It got rolled up into public health, but didn't have, the expenses got rolled up into public health, but the revenue did not. So that's what you're looking at on the screen right now.
Okay.
So the way it's going to change is, again, we're going to have some opioid settlement dollars come into the public health department, and there's going to be some modification in ERP, more accurately spreading the cost back to the departments instead of the overall funding source for ERP. So you will see, again, a balanced budget from the health department in that second iteration. It will use more grant dollars to make that balanced. So what you're seeing here is the unfortunate reality of kind of the boom and bust cycle of public health. When there is an urgency, there are a lot of dollars thrown at it. And when there is not, we are incredibly underfunded. And so that reduction by 42% in our grant revenue is specific to that.
Any questions for KT? All right, I need a motion to approve the public health 2025 proposed budget as of this date. Hey, Ms. Rudy, thank you. Is there a second? Oh, Ms. Supervisor Bashan, thank you. Any further discussion? If not, all in favor, say aye.
Aye.
Any opposed? And public health is approved, and veteran service.
I was able to successfully share screen,
Good.
so thanks for that extra time. So what I have up here is the 2025 proposed budget. The overall proposed budget of $308,124 is the same as what was brought in July. A couple tweaks. I spoke with Beata, CFO this afternoon in reviewing. I noticed a couple changes in some areas, and so she was able to update things. But the bottom line last month, what was proposed is it showed we needed an ask of $10,694 based upon the proposed budget. She had indicated that after going through everything again, our true ask was only $6,880 of levy to balance our budget. And through a number of different things, she had indicated that went ahead and put in a balance showing the revenue to balance the Veteran Service Office budget. The overall amount of the request of $308,124 did not change. However, last month's budget that was proposed showed that net deficit of the 10,000. And so the other part, when you look, if you kind of get down into the granular details, you'll see that roughly looks like $6,000 less from what we have currently approved for our 2024. Can be a little bit misleading, just for the fact that we carried forward money a little over $8,000 from last year. So just to identify that, so it doesn't give the appearance that we've somehow cut a whole bunch of money. There's not anything to cut. It was just the fact that we carried money forward, so it showed an increase, and that changed the 2024 budget. But our ask is again a minimal increase based upon staff and fringe.
Okay.
Any questions regarding those explanations from last month to this month?
All right, I need a motion to approve.
I so move.
Supervisor Steen, is there a second? Supervisor Hagan seconds. Any further discussion? If not, all in favor, say aye.
Aye.
Anybody opposed? All right, that is also approved. Thank you. Thank you for bringing this back to us. And we have a human services budget adjustment. Do you want to, money in, money out?
In and money out, and there's some small grants that we've been giving some funding to address this on it.
Okay. Any questions on this? If not, Supervisor Steen.
I move we approve.
All right, Supervisor Steen moves. Is there a second? Supervisor Bashan seconds. All in favor?
Aye.
Any opposed? The DHS budget adjustment is approved. We do have on our agenda a veteran service office budget adjustment. I assume that we are tabling this until next month.
I do not have any budget adjustment at this time.
I think that may have been a placeholder for all of us with budget adjustments and just deleting it as we go forward, moving forward.
Oh, so it's we don't necessarily need to take some action to table. All righty then. We are, unless we have announcements or questions or comments or congratulations to the staff, we are adjourned. Thank you, everybody. This is a record.
Thank you, Matt.